Okay. Good morning,
Yes.
afternoon, and evening, everyone around the globe. From my own end is morning. I know people in other parts of the globe, like those in Australia, is evening, I guess, and Nigeria is also morning. You are welcome to yet another series of webinar organized by Pharmacy Scholars Initiative, and is part of our series that we usually do to share best practices and also information on our colleagues. And as a reminder, Pharmacy Scholar Initiative is a forum of top-notch pharmacists with common interest in research, career development, and mentorship. We were incorporated with Corporate Affairs Commission of Nigeria in 2017. And what we basically do is we do research mentorship, career development, research collaboration, community engagement, and professional development. Before we proceed into the webinar proper, I think it is good to have some house rules that will help us to better get the benefit of this webinar. So if I will remind us that we should please mute ourselves to limit background noise, and also utilize the chat box if you have any comments, questions to raise, and you can also use the other features of the platform to raise your hand and make any contribution if you want to make. And then we are going to have this session. The session is basically going to be in two parts. The first part is going to be the presentation by the speaker, with who is not other person but our president, Dr. Ibrahim Jatau from the Department of Health, Tasmania in Australia. Dr. Jatau is a household name as far as this webinar is concerned. It is his brainchild, and he holds a PhD from University of Tasmania and master's degree in Malaysia, and a Bachelor of Pharmacy degree from Ahmadu Bello University Zaria. So, and he has a very huge interest in this particular area, pharmacoepidemiology. So I think he's going to do justice to the topic. So, Dr. Jatau, you can now walk us through your slides.
All right. Good evening, good morning, good afternoon, depending on where you are joining us. As earlier introduced, I am Ibrahim, and I'll be the one leading you in this very relevant discussion this time. So today, our topic today is application of Google Trends in infodemiology. And the reason why we are discussing this topic today is looking at the current advancement in information technology. And as we all know, the internet penetration is almost in every nooks and crannies of villages, cities around the world. And most likely, or I could say, a majority of people now owns an internet-enabled device that they can access information at just a matter of a click. So this technology is also applied in public health or in health-related information, where people seek information for their own needs. So this information, we can also utilize this information to synthesize, or utilize this information or this technology to synthesize data that will guide development and implementation of some intervention that could prevent public health burden. So today, I'll take us through the use of Google Trends in utilizing information that could guide public health measures. So to make easy way to navigate through the webinar, we'll be talking about the background. So to know infodemiology, we need to know, or we need to have a background information about epidemiology, which is the big tree or the big family, or the general knowledge or topic about infodemiology. So we'll now come out and talk about infodemiology, then definition, how it evolved, use and application, then its limitation. Then we can now come and talk about Google Trends, then its application in infodemiology, and then we'll have a brief hands-on training. I will show you how to use these Google Trends to get information and utilize this information to have to utilize this information to write a report. This report could be a newspaper, scientific article where you can publish in a journal, or it could be in a newspaper, or just to improve your knowledge, or as a book chapter. So to start with, most of us from the science or medical related background, we all know what epidemiology is. It is a very common topic in as much as you are, especially those of us who are in public health related courses. So epidemiology is the study and analysis of distribution, patterns and determinants of health and disease conditions in a defined population. To break it into a layman language, epidemiology is a study of, like in a population, maybe in a Kano population, to know how many people have diarrhea, or how many people have malaria, or how many people have diabetes. So this is what you call the distribution. Then the patterns, how many percentage of males or females have diabetes, how many, like children from age 0 to age 5 have malaria. So this is what you call pattern. And determinants, what causes it? Maybe the presence of mosquitoes in the environment, unhygienic situation, like what causes it? So this is what you call study of overall study of this is what you call epidemiology. So to break it down, and that's what you call epidemiological information. So this is what you call, this is the information that is used to plan, implement, evaluate intervention to prevent illness and improve health outcomes. Assuming we are talking about malaria in Kano. So we need information about how many people have this malaria, in which region does this malaria cases is most prevalent. So this information is one that we collect to inform what are we doing? Are we buying them insecticide treated nets? Are we buying them like fumigation? Are we giving them malaria prophylaxis? So the information we gather will determine or will guide the intervention the government or any policymaker will give. So this is what you call epidemiological information. So as time evolved, this epidemiological information now evolved into something else, or to something new. That is what you call this in infodemiology. So infodemiology is like a combination of information and epidemiology. Initially we have epidemiological information. So as time advances with advance in technology, we now have information, technology now combined together and now give us infodemiology. And as it's defined by Eisenberg, is the study of describing and the analysis of health information and communication patterns, in most cases from web or like from the internet for public health purposes. So in summary, infodemiology is the analysis or the study of information generated or sourced or obtained from the internet in order to give us or to guide us on how to prevent public health burdens or public health and diseases. Well, I'll explain further so that you have more to have better understanding of what we are talking about. So how it evolved, because this is something new. Initially, we don't know anything about infodemiology. All what you know is epidemiology. So like I said, with the current trends of information technology, this topic involved. So it started in 2002 by this researcher who first used the term in the context of measuring and predicting the quality of health information on the web. So then I don't think there was this Google trend that we are talking about today. And then as time goes on, more information are coming, more consultations are coming. Then this definition was refined to include methods and technique to automatically measure and track information. And then this is through using of demand. Demand means analyzing search queries, like I need information from the internet. So I go there, I'll track COVID information. That is demand. You demand information from the web. So from the other back end, we now track your search queries. How many people search for COVID information from, for example, from Kano? Then that's what you call a supply. Supply is normally analyzing personal web pages, blogs, or social media. Okay, I can just come and open my Facebook and make a post about, okay, COVID information or COVID information overload and leave it like for 1 month. Then I'll come back, I will see how many people reacted to it, how many likes, how many comments, how many shares. So from that information I gathered, from that comment, I will now pick an information and I can synthesize it to make my decision or to inform a decision. And I'll give an example of some studies that use this pattern to pick information. So as it evolved in 2013, the field was formally recognized by the Global Health Intelligence Network. And I think this one is funded by Canadian Public Health Institute. And then, and most recently after the COVID, the WHO organized a global infodemiology conference to look at this infodemiology and to address issues related to COVID misinformation, COVID disinformation, and COVID information, to have the quality of information people receive from the internet about COVID. And from there, I think the consensus from this conference include like, okay, let's have like studies, more studies about infodemiology to really understand the data generated from this technology and to see how we can use this data to inform our decision. So from that conference, so many studies evolved, and I think that's one of the journal of internet medicine. There's heaps of articles on infodemiology on this, especially on COVID-19. We did an article on COVID information overload, but it is not directly related to this, but it's something on the track. So the application of this infodemiology, like number one, like I mentioned previously, but I'll repeat it now, is using the supply. So supply, like what I said, is to collect the data based on comments, likes, and shares, tweets on Twitter and Facebook, YouTube, and Twitter, which is formerly called Twitter, now is X. So analyzing how users interact with the public health related content on publication on the internet. So like I mentioned, number one, using comments. So number two is like people create a blog. So in that blog, they'll create like, they publish an article, for example, about vaccination. So, people believe in the vaccination, some doesn't, some said it's a political, some would say is to introduce contraception. Like there are so many issues around it. So people will now post an article on that blog, and they will now leave it and now monitor how people interact to it. So in there, you will know those who are commenting based on like supporting it, and some will be posting, making posts on that blog, like against it. So at the end, as a researcher, you will now collect this information and do what you call qualitative thematic analysis to now pick the information about the pattern. Are they support, not in support? Then you now use your use some data, some literature to support this, who are against or who are not. And at the end, you now bring your article or you now bring your information. So this is this side. And the second one is, this is an example of the study that used this pattern to collect data and publish information. Like this one is like preventive behaviors conveyed on YouTube to mitigate transmission of COVID-19, cross-sectional study. So these guys, what they use is they use a YouTube content and comments and likes to see how preventive behaviors information is conveyed through YouTube to prevent transmission of COVID-19. And I think they analyze like hundreds YouTube content, like YouTube videos, and then they analyze the content, they analyze how people reacted to it, the likes, the subscription, the sharing, and the comment people make. But now they now see, does that YouTube really convey information to prevent transmission of COVID-19, or does it prevent it based on the comment, or it does not? Like, this is how they approach it. And then there's another one on infodemiology of alcohol use in Hong Kong, mentioned on blog. This is the example I give you about use of blogs. So these guys, they created a blog post about an alcohol use in Hong Kong. And now what they do at the end, the resulting blog posts were analyzed quantitatively using epidemiological metrics and the correlation coefficient and qualitatively by manual efforts. So that means they use the two methods, quantitative approach and qualitative approach. At the end, they now have the information and make it published. So these are, to summarize, the epidemiology, you can use it in two ways to get your information. Number one, to use demand by using queries, or supply by analyzing comments posts on Facebook. So this is one example of one of my friend, Kende Bamiro, and I think most of us from ABU, we know him. I think he's now an associate professor here in university in Australia. And he used this like, comment, tag, share, Facebook interaction in health research. And this is what he posted an advert on Facebook, and he gave it a time period, and he analyzed the number of comments, shares, tags. From there, he now synthesized information and published it here. So you can also do it. So this is infodemiology. I've not yet started talking about Google search. So the next aspect of it is the demand. This is why you analyze how people search and navigate the internet for health-related information. Meaning, you can know, like today, someone in Uganda search COVID information, somebody in US search COVID information, somebody in Canada. So you can use Google to know how many people look for information about COVID information from the whole world, globally, from a particular region, from particular sub-regions, and that will inform you the public interest about that topic. And from there, you can generate more data to see the trends, and from there, you can now synthesize information and make it published. And this is where Google Trends come in. And this is where we use Google Trends to search or to obtain this information through Google search, through how people search for information from the internet. So you now use Google Trends as from the back end to collect those information and use that information to publish reports and to synthesize an information or report for public health purposes. So as we have been talking about in infodemiology, now you want to use Google Trends. And now how can you use Google Trends in infodemiology to extract data that will inform public health interventions? And use also this data to publish paper, and you publish it in a very high impact journal. And in 1 hour, you can collect your information, analyze it, and get your results at hand. So what is this Google Trend? So Google Trend is a website by Google that analyzes the popularity of top search queries in Google search across various regions and languages. How? Number one, it is launched in May 2006, and it monitors what is trending across Google Search, Google News, and YouTube. These are the 3 key platforms the Google Trends picks information to post it on its homepage. Sorry, there is spelling error, it's trends. So it's also see that you can also use Google Trends to see the topics people are or are not following in real time or over a period of time. So it's not all about public health information. It is general, it is on everything, but you can only apply it to search for information about public health information. So, and you can also use these Google Trends to compare search volume of different queries and region over a period of time. Like you can put malaria, so you can compare number of people search or people's interest or public interest about malaria in Africa, where we have high prevalence of malaria, and those in the US. So you can compare these 2 regions to see the information seeking behavior of people in the United States and those in Africa about what? Malaria. So that's what you say. You can compare the search volume from different queries of different regions, or you can compare people's interest about malaria in Africa, and you compare it about people's seeking behavior about diabetes in maybe in the US or in Jamaica or any other region. So you can have the two data, so you can compare them, extract information, and have it published. So how does this Google Trends works? The Google Trends homepage, okay, how it works is you just have to, it's not on Google search. So it has its own homepage, and the address is there, google.com/trends. So in the trends, how it picks information, this is what I picked from the Google Trends webpage. Trending stories are collected based on Google's knowledge graph technology, which gathers search information from Google search, like I said before, Google News and YouTube, and detect when the stories are trending based on the relative spike in volume and absolute volume of searches. So that is how it's used to pick information and bring it to you on the homepage of Google Trends. And the homepage shows the topic that are, so if you visit the Google Trends now, it will immediately show you the trending issues in the world now. What is trending, what people most frequently search on the internet as we are talking to you now. Let's take a look about the homepage of Google Trends. So this is how it is. This is the Google Trends. This is the homepage, and this is the search box where you type in the topic that you want to search. And if you check here, you will see Formula One. Formula One is what is among the topic that is currently trending. So most likely there is Formula One championship currently going on. And why is it trending is here. Can you see F1 Pro Photos GP USA 2023? So you can see the reason why this F1 is Formula One is trending now. And if you scroll down, you see other topics that are currently trending now. I will show you how it is live. So after this, when you know the top in the Google page homepage, knowing how to do it, which I will show you in the hands-on aspect of the training. Now is how to apply or application of Google Trends in Google. This is the main business of the lecture. Sorry, application of Google Trends in infodemiology. Now, knowing infodemiology, knowing Google Trends. Now, how to apply these Google Trends in infodemiology. This is what I'm going to show you now. So Google Trends can be used to collect, analyze, and synthesize public health related information based on such queries, as I explained before, that could guide public health intervention. So how do you collect this information? You can also explore the pattern of information seeking pattern of a particular region, of a particular topic in a particular region. So that's a word missing there. To explore the pattern of information seeking pattern of a particular topic in a country or in a region. I think I explained this not long ago. And to compare data between two or more countries. And you can also use it to know or to monitor the spread of a disease in a region, or to know the vaccination uptake in a particular region, or the pattern of something. You can use it to collect as much information as possible. This is not exhaustive, the list is not exhaustive. There are so many information that it's up to you. It depends on your research question. That I'm just giving you an example of what information that you can pick from Google Trends. So how to use the Google Trends to collect data? There are so many steps. I will show you the step here, and then we'll do it together with you to see how you can pick information and how you can synthesize it to make use of it. First is to visit the Google Trend page, and this is the link. And number two, to enter or to key in the topic or the keywords in the search bar, just the way you do your normal search on the internet. And then you click, and in seconds, everything will come down. So you visualize your results based on figures and based on like data visualization, like in graph. You see that you can see the trends just like graph. And then you can now, if you want to compare two more topics, like I said before, you can click plus compare. Then you can key in the keyword or the topic. And then you can remove a topic by clicking nice. I will show you the three dots. You can click the three dots, the topic will appear. You can delete from there. And then, so you can now download, when you have everything on, you are satisfied with what you see, you can now download the data in Microsoft. The data is by default in Microsoft Excel. So you can download it and analyze it. You can use the Microsoft Excel if you are very versatile in it, or you can use XPS. You can export the data from the Microsoft Excel to SPSS or to R or to any software that you can know how to use best. Then from there, you can now report the information in terms of journal article or newspaper or a report or a thesis or anyone you want it. So this is how it looks like, the Google trend. I just type in vaccination and look at how the trends that it shows. So from, you can see in this month, October, I think towards the end of the month, around 21st, there's a little bit spike in people's interest about vaccination. Most likely there was a news regarding it, and people quickly went to the internet to seek more information about it, most likely. And this year, it will show you the regions where you have higher volume of people searching for the information about vaccination. And here it will show you the like something like a bar to show you in this region, also percentage like per region. Then at the end, you can see an arrow where it will show you where to download. I will show you this one on hands-on, and then you can also share the data to other contacts if you want. So I'll give you an example of studies that use Google Trends in infodemiology. Like number one, there's an online search behavior related to COVID-19 vaccine. This also used the Google Trends to analyze data or to monitor data or online search behavior related to COVID vaccine to see which region has more vaccine, seeking more public interest about vaccine, COVID-19 vaccine. And there's another one that's analyze public interest in immunity and a justification for intervention in the early stages of the COVID-19 pandemic. Analysis of COVID trends, analysis of Google Trends data. And you can also, there's another one, seasonality of Hashimoto thyroiditis, infodemiology study of Google Trends data. So you can, it depends on how you tweak. You can see the pattern of what people write on the topic. And I think that is something we can learn. This guy said online search, it's the same thing, it's the same method that they are using, but look at how they tweak the topic just to grab the reader's attention. This guy said online search behavior related. This guy said public interest. This guy says seasonality, meaning he compared the season maybe from winter, summer, all from January to February, from December, just to compare the trends and see. And public interest, like the search queries is what this guy described it as public interest. And this guy now, the online queries, this guy, the first one, he termed it or he coined it as online search behavior. So it depends on how you coin it to attract people's attention. And the best way to do it is just go to GIMR journal. You can see how people twist the topic to make it like to package the topic to grab people's attention to us, but it's the same trends that you are using. And I will show you how we use it. This is one of the study. I screenshotted. Like this, the online search behavior related to COVID-19 vaccine infodemiology study. So look at how they coin, and I think this one is also published in Journal of Medical Internet Research. So this is this for the hands-on, but before going to the hands-on training, I would like to summarize what I said. So from the time we started, I described what epidemiology is, and because infodemiology originated from epidemiology, and to appreciate what infodemiology means, we need to understand what epidemiology is. And like I said, epidemiology is the study of understanding the distribution pattern and determinants of disease in a particular population. And as time goes on, information that we're using to inform our decision to prevent some diseases, and that's what gave rise to infodemiology. And infodemiology is use of information from the internet to guide us in planning or developing intervention to prevent public health disease or public health burdens, or to improve disease outcomes in the society or in the community. And like I said, this infodemiology, it's you can use it in two, or broadly it's divided into two. Number one is by supply. That means by analyzing how people interact with social media or blogs, like how people commented, how people likes, or how people shares information on Facebook page or Facebook adverts or tweets or YouTube. That's the first part. The second part is by demand, like how many people search for information on the internet. We all know we all use Google most of the time. Only few people use Bing, but most of us and Yahoo, most of us use Google. So we now analyze how many people seek information about a particular health related topic. Then we now analyze the number of people to now make us to decide what to do for that particular topic, or what's that topic, the pattern, what is it saying, what is it telling us about a particular disease in a particular region. So we can now say, from there, we can now know how to use Google Trends to pick or to collect this information to analyze. So Google Trends is like a tool that we use to get information for epidemiological research. And like I said, Google Trends is part of Google. We have Google Search, we have Google News, and we have Google, YouTube. We all know the platform for Google. So Google Trends is another platform from Google. And we use Google Trends to analyze trending news, trending information, trending topics about a particular topic based on how many people go to the internet and search for information about that particular topic. So we now said we can use that Google Trending or Google Trends to analyze or to utilize information from people who are seeking information about a particular health-related topic. And from that Google, we can download data, we can analyze it, and we can publish it, and it is valid. It is internationally accepted. You can do it. The only limitation that I skip is, as we all know, not everything on the internet is something that you can rely on. So that's the only, that's number one. Number two, we cannot use what we see or what we receive from Google Trends to generalize information about a particular region, because not everyone owns internet-enabled device. And even if you own it, not everyone seek information from the internet. Some, despite the fact that they have smartphones, but they really rely on information from the news, from the TV, or from the newspapers. So information there, it gives us an idea of what's going on, but it's not a true reflection of what is actually happening. Or we can't use it to generalize information like the whole of this country, they have so much interest on this compared to, but it's giving us an idea. Okay, this is what's going on. So this is in summary what I've been telling you from the beginning of this webinar. And as I said before, I will have like a hands-on where I will show you how to use this Google Trend. Please, if you have your questions, keep it with you. At the end, I will attend it. With the permission of the moderator, I'll end this slide and open another browser to see what this Google Trends is all about.
Go ahead.
All right, sir. Okay. Come on. Do you see the browser? Hello?
No, not yet. Not
Okay,
yet.
you have not seen the browser. Okay.
We cannot.
Okay. Sorry, 1 minute. I will stop sharing this one. What about now?
Yes.
Yes.
Do you see the screen?
Yes.
Do you see the Google Trends?
Yes.
All right. So let's start. I think I'll bring it down here. All right. So like I said from the beginning, you type in Google Trends, and this is what it will show you: trends.google.com/trends. And this is how the page looks like. So to navigate you through, this is the title, and this is home to show you this home page. Explore, trending now. Trending now, it will show you what is actually trending now at the moment. Like if you click it, it will show you the topic that are trending at the moment. Like I said, this is F1, that's Formula One, RWC. This is like the country, this what do you call it? This game currently going on is very popular in Australia. Cricket, and I think Sri Lanka is playing Holland. South Africa versus England. So this is what is trending topic at the moment. So if you go back to explore, this is where you can type in any topic that you want. So we are talking about public health. So we can use vaccination. Any topic anybody can suggest, you can put vaccination or COVID-19 vaccination or malaria vaccine. Let me put COVID-19. COVID-19 vaccination, that's only what you need to do. You just type in. So from here, you will see the pattern from this month, from 23rd of October to 24th of October, that is 24 hours. I look at the number of queries about COVID-19 vaccination. And you can see it's like in Australia, it's like the whole region, I mean, all the regions, we have been searching about vaccination, COVID-19 vaccination. And if you can see around here, I think this is, yeah, Australian capital, no, this is not. This is Southern Australia. So you can see where it is highly dense. So this is the breakdown of the information. You can see COVID certificate, like subtopics about what people are frequently search about the COVID vaccination. Some are mostly it's about COVID vaccination certificate, international COVID vaccine, like you can see it around here. So you can adjust. This is just a particular topic like COVID-19. So if you want to add a topic like to compare, you can put it here. Possibly malaria vaccination. Malaria, you won't see malaria vaccination because they don't care about it here. They don't have malaria. You can see because there's less search about malaria vaccination because they don't have malaria here, but because it's a trending WHO trend, because I think recently they discovered, or there was a news about malaria vaccination. So most likely researchers or news outputs, they were looking for information about malaria. But COVID, because it is an ongoing thing, there's more information about it. And again, you can refine your search because this is all information about Australia by default, but you can put worldwide, like in the whole world, in the past 12 months. All categories mean from news, everything, how people and search it like science, reference, for news or anything, just put all categories. And we do by website, email search, Google search, shopping. So we normally put web search. The website, it encompasses everything. So from there, you will see globally from yesterday within 24, from past 12 months, that's from last year, October 23rd, there was like a drastic reduction in information seeking about COVID-19 vaccination. And because malaria vaccination is not a trending thing, you can see globally information seeking behavior about malaria vaccination, it remained predominantly unchanged, with just a slight spike around August, not July 2023, that's last month. So this is how you can do it. And you can see the regional, Google to show you by region, the places where they search more information about COVID. Like you can see in Canada, zero information about malaria. But you see in Nigeria, same, zero information about malaria vaccination. So you can see how everywhere, I think it's even in Australia that we have even some percentage about malaria vaccination. So New Zealand, zero. Yeah, so that's how you can do it. And you can see in a bigger map. And for malaria, you can see in the United States, there are 20 interests. In Sweden, UK, India, in Australia, we have 73. I'll have to check why there is higher interest in getting information about malaria vaccination in Australia. I'll check and see. So this is how the data, you visualize the data from the Google trend. And from there, you have every chance to manipulate your data to pick. It depends on how you want to write the story. And if you remove this, like I said, if you want to remove a topic, you can just click here, remove, it will go. So you can change the topic from malaria vaccination. Let me see, we can just put malaria, information about malaria, yes. So worldwide, yes, so you can see in the last 12 months, there is a little bit increase in interest, global interest about malaria, they too came down. Let me see Nigeria. So you can pick any country from here. This is Nigeria. Yes. So in Nigeria, you can see from last year, October 2022, you can see there was a drastic, and most likely if you think around June, maybe that is, if you check back home Nigeria, most likely that's the time when there is a high rate of malaria cases, mostly in the rural area. And maybe because of the season, the rainy season, and it keep going down. That is in April. Yes, that is April when we have the rainy season. Then it keep going down, down, down. It went up, it continued working down. So like I said, it will give you a lot of information about what is likely going on. So if you consider in Nigeria, I think Zamfara State, I think they are the one with the highest information seeking about malaria. I think you have Cross River, interesting. And then Jigawa, Kano is a little bit less, 67. So you can see how all the information, you can break it down, like this is Borno. Yes, this is Borno, yeah. So this is how the pattern in Borno State. In October last year, it peaked, and you can see. So from there, you can download the information from here. So let me go back. Let me see which another trending information do we have about public health information? I don't think blood pressure. Kamali, any other trending public health
Yeah,
information?
like diphtheria or Lassa fever, I think.
Lassa fever is an old. Let me see. Lassa
Diphtheria,
fever.
there was diphtheria
Okay, yeah,
outbreak.
diphtheria. Let me see. Yeah. So in Nigeria, yes, exactly. So we can see the public interest about diphtheria. It keep going down, 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 down. Possibly we have a case. I think this was in Kano.
Yes.
Then you have, so let's check Kano by region. So there's not even Kano, it's only in Kaduna and Abuja, then Southwest, then Edo. Yes. So this is how you visualize the data, and you can have it for okay. The only thing is Google Trends will give you information only from 2004 down, so you can have data from 2004 to present. It will condense the data and it will give you everything about it. So I think there is a very highest peak in October 2004, and since then it got flattened, and then you have the, so you can, it's still in Kano, it has the highest, then followed by Kaduna, Ocean State, then yes. So this is the major topic. As a disease, as a topic, there's a vaccine. Many people are checking if it has a vaccine. And then this is what people are normally asking, what is diphtheria, tetanus, like. So if you want to download this information, you can click here. So if you click here, you click Excel and the result will automatically open. Did you see the Excel output? Kamalu?
Yes. No.
All right.
No, I
No,
can't
it's
see.
not showing CSV.
It's not showing?
Yes.
Or maybe I have to share it again. All right. Anyway, let me Lassa fever. Or maybe snake. Since snake man is here, we can use snake. All right. So also like Lassa fever 2004 is where they have the highest. And the region is Bauchi, Kebbi State, Edo. So you can see the distribution. And I think if you use worldwide, let me see. So worldwide, it's mostly in Nigeria, 94. Liberia have the highest, followed by Nigeria. And then these countries, possibly they are looking for the information less than one, less than one, less than one. Anyway. So that's it. So if you want to download the information, you can just click here. Let me download. So I don't know why it's. Do I need to share another screen to show
Yes.
you? Okay,
Yes,
okay.
please.
Okay, so let me, I hope this Google is giving me multiple. Just 1 minute, please. I'm trying to see if I can share it. Sorry, guys.
That's fine. Take your time. Can we all mute our speakers, please?
Hello, the audio is so low. Dr. Jatau.
Dr. Kamal, hello?
We cannot hear you.
Yeah, can you hear me now?
Yeah, we can hear you, but we cannot see your screen. We cannot see anything. It's
Okay, so I'm sorry. I think I'm getting some challenges getting this.
no, it's fine. Take your time.
Getting this. Yeah, I think it's coming. Window. Yes, yeah, I think I've gotten it. Yes.
Okay.
Yes. Can you see it now?
No.
You cannot
Yes.
see it.
Yes, we can see it now.
Yeah, so this is how it appears on Excel. The data on Lassa fever.
But come back, please. Okay. What does
Yes.
we have seen the months? What does the numbers mean?
Yes, so this is the number. This is like the queries on this day, like on this month, January 24, February, March, April, like this. So this is the number of queries, number of
Okay.
search on
Okay.
this topic worldwide.
Okay.
So again, if you want, let me stop sharing and go back to my topic. Yeah, so this is data representing this. Then also you can pick or you can download this to have this data from this region, or to have this portal from this. Are you getting my point? So you can use this, you can actually make this, or you can actually put this in your research. You can either screenshot it or you can download it from here. Do you see this, my slide?
No, we are not seeing any slide at the moment.
What's going on? Okay. Oh, sorry, it's my fault. Do you see it now?
It's coming up. Yes.
Yeah, we can see.
Do you see the Google Trends?
Sure.
Yeah, so what I'm trying to say is the data I show is the one from here. So here you can also download here. You can now see the data split by region. And also you can screenshot this portal, all this graph worldwide to show you the distribution of queries from different region. And like I say, you can also share this on Facebook, on Twitter, or on LinkedIn. So it depends on how you manipulate your data. So this is just a brief information on how you can use Google Trends to collect data on infodemiology and use the data to analyze, write a manuscript, interpret the results, discuss it, and publish it as an article. And like I said, and as I will still repeat, do you see this page? Kamal?
Yes.
Yes, so you can see this journal. If you check this journal, there is a lot of research on Google Trends, on infodemiology using Google Trends. You can just click Google Trends here, and it will give you a lot of information about a lot of papers, published papers on different topics about the Google Trends. And these are journals under this. So we can just click any one. Let's start with this one. And this is the one I use to give the example. So this is another one, public interest, causality analysis, predicting norovirus in the United States using Google Trends. Can Google search predict popularity and harm of psychoactive agents? So you can see this and you can see a lot of, let's click one and you will see how they present the results. Sorry for taking your time. I think my time is up. So this is how the paper is published. And you can see the background. The method or line search was performed using the term osteoporosis in Google Trends from January 2004. That's what I told you. It all started by default from 2004 to December 31st, 2019 under the category health. So this guy refined it to just, like I said, he refined it around here, categories, and he only picked health just to show this health, to refine the research, to see more that is a little bit more related to health. And then, that's only thing and that's the only thing in the methods. And you can see there was a descending trend of global RSV for osteoporosis. And at the end, I think this is a free journal, so you can. So do you still see the window? The PDF is open. Yes. So you can see this is the published. This is just a full paper, and you can see the method section, very brief. No need to pay for survey, to start asking people, begging them to fill it. And you can see the methods.
Scroll down, please.
Okay, do you see?
Yes. Scroll down.
And you can see region analysis, statistical analysis, and that's what I say, you analyze. And then availability, you don't need to ask for any, what do you call it, for any ethics approval. So this is the result. And you see, figure one, see, you can just screenshot, copy, paste, done. See? And then look at the data from that page, copy, paste, done. And I think it's yes. So I think this is the only thing that the guy tried to do to make some comparison, and his p-values are here. And look at this. I think he's trying to compare. Done. That's it. Boss. He just discussed. And yeah, I think this is another more information he picked per country, and then the discussion. and done. Conclusion, his paper is published. And look at the limitation. Like I said, the limitation is did not measure the prevalence, but rather contain the that might be influenced by several confounders, already known facts across the sensor. So this is like the general shortcomings of internet research, and its conclusion are here. So in summary, this is how we use Google Trends to synthesize data from the internet and to use this data to publish a paper, and that paper will be used by policymakers to guide interventions and possibly to prevent any adverse outcome. With this, I would say thank you so much for listening, and I will really welcome observations, questions, and suggestion. Thank you so much. Thank you so much.
Well, thank you so much, Dr. Ibrahim Jatau, for doing justice to this paper. Jatau has actually brought us to speed regarding infodemiology, and I know it's now a trending topic within the public health, infodemiology and infovalence, which is now the topic of discussion. I know we have a lot of questions. Someone has raised his hand, or his or her hand. So we'll now allow participants to ask questions. I have some few questions, but let me allow people to ask first. Let me check who is the first. Somebody has raised his hand. Let me check his name. Someone has raised his hand before. Okay. Before the person comes, I think I have some few questions to ask. Well, my first question is based on the data. I know this is a very, very, very good area to leverage on, particularly those of us from pharmacology background, doing ethnopharmacology, they will know what I mean. When you look at some, you want to do some research on some medicinal plants, and there is no documented evidence around it. So if you have a data from infodemiology studies, I think that will be a justification for you to move ahead with your research, something like that. Maybe you have somebody has used moringa maybe to treat diphtheria in Kano, but you've searched all the available evidences. There is no use of moringa, but there is somebody in far away, say Lagos or Edo, has done an infodemiological studies on moringa, and he has combed the internet. After combing the internet, then he realized people in, say, a particular area in southeast or northeast are using moringa to treat diphtheria or to treat Lassa. So that will be your justification for you to move ahead with your study. So I think it is providing us a very good springboard for our studies. Then my question is going to be to you, Dr. Jatau. At what level will you place or situate data gleaned from infodemiological studies on the hierarchy of medical evidence? Is it going to be in as an expert opinion, a case report, a case control, or a court studies?
Oh, okay. Okay. Can I? Okay. So you have two questions.
I have two or three, so to say. So I think I want you to answer this, then I can go to the next one.
Okay. Yes. So for this one, like I said, it is number one, it is original data. So that means it is not a review, and I could say not an opinion or not an opinion. So most of these studies are cross-sectional. Like if you go to this journal that I just showed, most of the study you can see it ends like cross-sectional study. So I would say it is cross-sectional study. That's the cross-sectional is at the bottom of level of evidence, because you can't use this one to information based on this epidemiological study to make a decision of a very sensitive health-related issues, especially like drug development, yes, or vaccination development. Yeah, so you can't use this as a strong evidence. So this is an evidence that really needs more evidence to support it. There is some systematic reviews on studies that compare more studies on infodemiology. Even that is not a strong evidence like the one that you can use in prospective or longitudinal studies or even retrospective cohort studies. So, but this one is just telling you and just giving you a hint about a particular situation that is something, the trending, do we need to look at this? But it's not, let me say, it's not a strong evidence, but you can use it as an evidence at cross-sectional level and studies, cross-sectional study level. I think it's the second in the pyramid of hierarchy.
Okay. Well, thank you for this answer. And
Yes.
the other question I want to also make is that even though you highlighted some of the limitations or the weaknesses of using Google Trend, which of course we know that we have other search engines like Microsoft Bing, Yahoo, and what have you. But in the research parlance, there is this view that looks at data emanating from Google, whether being it Google Trend or Google Scholar, as purely a gray literature. Is as evidence not to be fully relied on, because you look at, when you're looking at health and research repositories, databases, you talk about Scopus, Web of Science, CNOW, Medline, and what have you. I think this is the gold standard. So now it becomes very, very difficult. Maybe I know there are a lot of research going on, and in the journal, in the article you just shared, I'll just look at. It's a very high ranked article, journal with an impact factor of about 7.0, which is, it means it is very, very high. So I know, how then will you reconcile doing a research with a gray literature or gray resources like Google, then and marrying it with the conventional scientific databases?
Yes. Thank you so much, Dr. Kamal, for bringing this. So there are two issues. Number one is you are talking about information from internet source as being gray literature, meaning they are not peer-reviewed articles or they're not peer-reviewed information. So there is highly tendency of it may be true or false. But in Google Trends, it is absolutely a different game. So in Google Trends, you are like working from the back end. You are not using the information obtained from from Google. What you are monitoring is how number of people going to the Google to search for a particular information about a particular topic. So the count is about the number of users, number of people searching for information on Google. So it's not about the information you obtain or the quality of information you obtain from Google. So assuming if you're looking information about maybe malaria, like the example we gave. So if you get like a newspaper report about signs, symptoms, prevalence of malaria, and prevention, risk factors, this is something different. This is what you call about the gray source, gray literature. But in Google Trends, it's talking about you, Kamalu, going to the Google to search for the information. Kamal in UK, Abubakar in Nigeria, someone in Malaysia, meaning 3 people searching information about malaria. That count is what Google Trends use. So it's not like, it doesn't matter whether the information the person in the other end received is true, false, genuine, whatever. All what you're after is that interest he has to go to the Google to search for that information. That is what the Google Trend is counting. I hope I've answered you, sir.
I
Not
think
the
you have,
quality of information the guy received.
you have brilliantly answered my question, and I'm
all right. Thank you so much, sir.
It's not about the quality of the information, but the number of users, and I think that is where the message
Exactly. Yes.
I
Exactly.
can see Yahaya Adinoy is raising his hand. You can now unmute yourself and ask your question.
Thank you very much, Dr. Kamal and Dr. Jatau. It's great hearing from you guys. We are proud of you guys. You are doing us great as a nation and as a people. I was actually thinking in my head what the whole application of Google Trends was until Kamal started asking his questions, and I think I got a better clarity from the responses from Dr. Jatau. I want to say specifically that I want to thank Dr. Jatau for bringing this topic. This is apt, and I think it has actually improved my understanding on Google Trend. I've actually heard of Google Trend, but I never really give it a thought that much. Thank you for this enlightening topic. But on my own, I was still asking in my head, what exactly can we say is the application of the usage of Google Trend, especially in our contemporary society today? How do we begin to make, what exactly are those beneficial derivatives that an average Nigerian, for instance, where I am, will get from the usage of Google Trend? Maybe I didn't really get the explanation around that, basically. Thank you.
Okay, thank you so much, Yahaya. The first time I know you was in UJ, I think in 2000 and Kamal, it's 2000. I can't remember the year. 2005, is it?
2004.
2004, yes. That's yes. And I think I saw, was it in Kano? I can't remember where we met, Kano or Abuja. Thank you so much, sir, for joining our webinar, and I really appreciate your comments. Yes, so there are two things. So number one, like we are all pharmacists, but we a little bit went ahead or went into research. So most of this data from Google Trends in Infodemiology, we use it for research, meaning the research to give us an idea about what is happening about a particular disease or particular public health topic in a particular region. And that idea will now inform us of what to do, the next line of action. So, like, let me give you an example. There's a paper in one of the African country. They try to I think one of the health agency, I think they try to marry or to have information released from health agency and the number of queries on Google. So, and they found out that anytime maybe this that health agency made any announcement about or make a policy about COVID, maybe people should wear a face mask, social distancing, like any COVID-related policy, and at that month, they now check Google Trend to see any trend in the number of volume people search internet, and they realize any month there was an announcement from that agency, the Google Trend it tally, like you see a spike in the graph on the number of people that search the information about that particular information. So it's like they use that Google Trend to validate people's interest about COVID information related to that and Department of Health of that. I can't remember the country, but that paper is in this journal Medical of Internal Research. So at least they use it to validate such information from that ministry and to see the people seeking health seeking behavior about and health topics, especially in a pandemic era. And this is just an example of how we can apply this Google Trends on this. And like I said before, Google Trends doesn't just stop about public health information. Google Trends is about anything. You can use it to monitor election, like you can type election in a particular country and you can see the spike, you can see the number of, you understand? Or just type Gaza now, you will see the number of information people are looking for about Israel, Palestine, misunderstandings, or Gaza, what's happening in Gaza. You can see the number of information from each region around the world. you can see the number that is this country has more interest in what's happening in Gaza than this. Or if there's any Premier League, just type Manchester United versus Arsenal, and you will see, let's see it. You can just see Premier League, Arsenal, and maybe Manchester United. Sorry for Arsenal. I know Kamal is an Arsenal fan.
No, mind you.
Manchester, I'll just put mine, Manchester United. So you can see, and then, can you see? I think people are more interested in Manchester United. Okay, this last FIFA, sorry. Arsenal FC. So you can see it's like the same interest, similar interest. So if you see any spike, most likely there was a match of Manchester or Arsenal. You can see the trend. You can from 2004. If you see in the last, in the last 12 months or in the last 7 days, you can see the trend. I think there was a match. I think there is a Manchester match most likely. So you can see the trend, and you can see per country. And let me see the worldwide, and you can see per countries. You can see Nigeria. Nigeria, the circle of Arsenal. You can see Arsenal and 51 Arsenal, 49 Manchester United. You can see these guys, Argentina, more of
we cannot see
Arsenal. Maybe there's one from, maybe there's Argentine player in Arsenal, I don't know. So, if you go to UK, Arsenal, this Turkey, more of Arsenal.
Yeah.
So
we are not seeing
like,
screen, sir.
Yeah, not seeing my screen.
Yes, we are not seeing any.
Yeah, I think you are not sharing the screen.
Yeah, we are only seeing the PowerPoint.
Sorry.
Yeah.
Sorry.
When it comes to Nigeria, I think you have more of Arsenal fans in Nigeria because
sorry,
we have Manchester fans more than
we're not as devilish as on my you are.
Okay, sorry, I'll just show you now.
But Manchester United have more fans than Arsenal.
So do you see it now? Do you see it now?
Yes.
Okay. So
Yes.
So you can see Arsenal, you can see Manchester. So from here you can see Nigeria. You can see 51% Arsenal, 49 Manchester. So that's it. So you can navigate through so many countries, and this is Egypt, more of Manchester United. And so as it is, you can see, you can navigate, and Poland as Europe. Yes. So I know, yes, Australia is 50-50, South Africa. Yeah, so you can see the distribution anyway of anything, any topic. So if you're in social science, you can type your topic that related to social science. You're in sports in the United States, almost 50-50. And also you can, this is by region. Which country is this? Tanzania, Uganda. All right, so this is how you use this to have more information about anything that you can think of on the internet. In as much as people are searching for it, you have it here. So, and we can see it in Nigeria. Nigeria, let me see. Yeah, so yes, almost the same. October 75, Manchester, Arsenal, and you can see states. Yobe almost 100% Manchester United. Kano, 41, 59. This is like Yobe, they don't even care about what's going on. Katsina, same. All right, so that's how the data is presented, and you can put any topic and you can navigate through to see like anything about it. So any more question?
Any more question, please? Question, comment? Well, let me check.
Okay, sorry. I think I don't think we shared the link for. Okay,
No, it's shared.
Right.
It's
Yeah,
shared.
okay.
Yeah,
Yes.
you can
So,
notify them.
yeah. So participants, I think we should give them some time to fill up the form. Like if you want to have a certificate for this webinar and give us a feedback, it's just 3 questions. You can fill it through this form. So you can provide just your name and the email address where we can send this. I think Wada is raising his hand.
Okay, Wada, you're raising your hand. You can unmute yourself, please.
Assalamu alaikum wa rahmatullah. My own is just to like, let me say a positive comment. Thank you very much. I have actually learned a lot. In fact, recently I intended to do a research on a trend of use of some medication in the tertiary hospital, and in fact, today's webinar actually opened my eye to a lot of possibilities, and I really thank you very much for organizing today's webinar. Thank you very much, sir.
All right. Thank you so much, sir.
Thank you, Dr. Jatau. And just to reiterate the last point that the speaker has mentioned, you can see from the chat box, there is a link for you to attendance link. You can click on the link, put on your information if you are interested in the recording and the attendance, and you can also give us feedback through that. And I think in the absence of any other question and comment, we wish to thank Dr. Jatau for preparing and also giving us this thought-provoking lecture that has opened a lot of eyes, even for me. And I'm considering being an info epidemiologist myself.
Expert. You're highly welcome, sir.
Oh, thank you so much. And thank you all for attending. And we would like to invite you for our further webinars. You can keep,
Dr. Chaban is giving closing remark.
Keep yourself, and I'll also keep abreast with all our information on the social media platforms. So, Dr. Shaban.
Yeah. Thank you very much. Okay. Yeah, sorry. I thought you'll just give the closing remark, but thank you for inviting me. I would like to use this opportunity to thank everyone for attending this wonderful webinar. It's really an eye-opener. Like, to reiterate that, I've really learned a lot. Initially, I was thinking of something totally different, but after going through the presentation, then I realized, okay, it is saying entirely something different. So really, it's really enlightening. And we really thank you, Dr. Jatau, for sparing your wonderful weekend. Despite being there, I think it's already night there, and then giving us this time, and so thank you, and thank you very much. And we also want to thank all participants for sacrificing their weekends also to be with us for this knowledge sharing. It's really a wonderful experience, and that is the motivator really, because if the participants are not here, then the knowledge shared will not be useful. But anyway, we are going to share. I will just want to finalize. I will share the recording if you share your information through the link, and then any other useful document related to this wonderful topic will be shared accordingly. Thank you very much, and have a wonderful day ahead.
Thank you.
All right. Thank you so much, everyone, and have a lovely night. Bye-bye.
Saibu Matras.
Okay, we'll go on.